Thank you very much for taking the time to join Sarah and I's team today on Digital Health Accelerators. Really excited to, I think, keep the conversation going coming out of the first session. I actually think that kind of teed up this session nicely. But just to kind of set the stage here, the objective of these breakout rooms is really not for us to speak at you or to have it be a traditional Q&A, although we are happy to answer any questions that you have, but really to kind of set the table for a broader conversation and more in-depth discussion on digital health accelerators, how we work with startups, what our mission of our groups are, and et cetera. So really excited to hear everybody's thoughts and perspectives today. Before we kick off the discussion with a little bit of intros from myself and Sarah, is there anybody who's willing to take some high-level notes for the conversation and then share out at the end of the discussion? I promise you don't need to come up with the key takeaways. Come up with those together at the end, so no pressure there. It would be great if I could have a volunteer before we get started.
I'm happy to take some notes, Jake.
Great, that'd be great.
Victor.
Victor, can you plan on sharing out some of the key takeaways at the end as well that we come up with together?
Sure thing.
Great, thank you very much, Victor. Great, so I will kick things off a little bit with an intro on myself and then pass it over to Sarah. So my name is Jake Dimidaris. I'm a senior strategy associate within the Innovation and Digital Health Accelerator at Boston Children's. So I work under Sarah, who just was involved in that panel discussion. My work is largely involved with sourcing early stage startups and identifying promising partnerships for the hospital across our different digital health verticals and focus areas. Also do work with internal innovators as well, but most of my domain is really in the sourcing of the early stage partnerships. So very excited for the conversation today, and without further ado, I'll pass it over to Sarah to introduce herself as well.
Thanks, Jake. Hello, everyone. Great to be here. My name is Sarah Constantino. I'm an Associate Director of Product Strategy on the Fusion team. Fusion's within United Health Group, specifically Optum. And so when you think about United Health Group, there is the health and tech services side of the house, which is Optum Technology, and then there's United Healthcare, which is the insurance arm. And so within the broader organization of 325,000 people, my team is an internal enterprise accelerator. So we work with teams in United Health Group to help get new products, services, ideas, experiences to market faster. And so we've had the opportunity to work with internal businesses to develop and incubate and launch new products. We also have worked between those businesses and maybe an external partner entity. And we've also worked with some of the new venture groups that exist within Optum, UHC, and UHG, helping them bring those startups in and essentially integrate them into the different business lines and get those products launched and out the door. So a lot of fun work that we get to do on the day-to-day and kind of get to see a broad spectrum of both internal innovators, entrepreneurs, as well as external innovators and entrepreneurs. So great to be here. Excited to have the conversation with you all and provide the perspective that I can bring from the work I get to do every day. So before we get into the discussion, I think it'd be helpful to learn a little bit more about who the folks are in the room here and how some of your backgrounds or interests relate to digital health accelerators. And so we can either have people speak up, or there's a little reaction button at the bottom of the Zoom call. And so we'd love to understand, are there anyone here that's currently working in an accelerator? If you could either speak up or raise your hand from a reaction standpoint. One. All right, got one person working in an accelerator, so that's perfect. So the other area might be, are you a startup looking to work with an accelerator in the future, or are you currently a startup working with an accelerator? Okay. A little bit more there. Excellent. Are you an individual in an organization that's looking to start an accelerator? Maybe there's not one established yet, but something that you are interested in starting now. All right. Or are you just curious about the conversation and want to learn more? A little bit more broad. All right. A little bit more broad there. Excellent. So for the folks that mentioned that they currently work within an accelerator within your organization, I think a lot of what, there's probably some common challenges that exist within your organizations in running an accelerator or working in an accelerator. Be curious to open up the conversation to use some of this time to maybe support each other in problem solving, collective problem solving. What are some of the challenges that you're experiencing within your accelerator today?
So I should note that when I originally lifted my hand for that question, I thought that the question was, are you a startup that is currently participating in Accelerator? So I'm not running an Accelerator, so I figured I would clarify that. So I don't have anything directly to contribute to that question.
Yeah, no worries. Actually, do you want to, so part of what we would love to do is when you speak, actually introduce yourself and then just let us know, where you're from or maybe a little bit about the company you work with or for. So we'd love some background on that if you don't mind.
Yeah, absolutely. So my name is Mateus Tura. I'm currently the founder and CEO of a very early stage startup company. And I am based out of Boston, Massachusetts. But basically the startup that I'm in the process of building out is a wearable technology startup that analyzes an athlete's form and efficiency to help them move better. So that's the gist of the idea.
Well, actually, can I maybe flip the question on you a little bit then, Mateus? What are some of the frustrations or roadblocks or things that you try to maneuver when you're working with an accelerator or with a health system or a plan more generally? Would like maybe we can get the conversation started there.
Healthcare is complicated.
Indeed.
I think healthcare is very complex. There are tons of different systems in play. There are so many different like hierarchies that you have to sort of work through and understand like who exactly are the decision makers for implementation of specific technologies and stuff like that. And that can oftentimes be like one of the hurdles that come into play. And even like from my perspective, just thinking through like, in order for the technology to be implemented inside of a hospital, does it need to be covered by insurance? And some of the concerns that arise with some of those questions are definitely fears when thinking through implementing technologies into a hospital setting.
That's a really good point. That's actually a pretty significant role that, as an innovation, as a digital health accelerator or the innovation arm of the hospital, we really are trying to serve as kind of the navigators for identifying who those clinical and administrative decision makers are to identify the clinical champion. But then ultimately too, I think the final stage, which always can be a little bit tough or tricky to navigate, especially for early stage startups, can be a little bit of the ROI side of things as well, and being able to generate a clear ROI for the health system. So that's something to think through as well.
Can I ask a question?
Please.
Absolutely.
I don't know where I would fit in here, but I'm part of a very small early stage medtech accelerator out of Providence called NEMIC. And we had a behavioral health startup with AI ML underlying tech stack, trying to really do personalized mental health for young people. And one of the big challenges I'm running into is at NEMIC, we are stepping through the process of getting market validation and things of that sort. So that's the easy part for me, because I come from a business incubator at Verizon. We have done that quite a bit. The hard part for me is really to be able to really imagine what the value proposition story is for an enterprise level integration with hospital systems, things of that sort. Because the initial play for us is clearly B2C or direct to consumer. And the play that seems to be more interesting for some of the larger companies and hospital systems would be probably B2B2C. But the route that I would like to take is D2C, prove the outcomes, prove the efficacy, and then try to do the integration. So the value prop and the integration pain points would be great for us to learn and understand, so we know how to prepare the company.
Yeah, it's a great question. There's definitely a good amount there too. I would say the where health systems fit into in the increasingly direct to consumer market is a particularly challenging one. It's something that I'm constantly thinking about as the innovation arm of the hospital. And I'd be very curious to hear the payer perspective of this too as well, Sarah. But I think whatever you can do in order to try to demonstrate some level of validity, clinicians are going to want to see data, especially before they use it with their patients. So it's great to be able to collect data in that way and get legitimacy there. B2B to C models with the health system serving as the middleman can absolutely work, and there's a lot of examples of that. You have to just create a very clear value proposition for the hospital to be able to be pushing that product, to be in some cases buying it themselves and then selling it to patients. That can be a struggle for health systems to do. So thinking through those kind of challenges.
Right.
Yeah, I would just yes, and to Jake, I think it's an interesting space, and so when I think about it from that kind of payer perspective, we do a lot of work in the behavioral health space. Much of it is obviously positioned toward adults, and so when you think about that, and you think about if we're creating innovations that can be coupled into health plans that typically serve the direct beneficiary or the direct prescriber of that health plan. However, many of them have children that are also beneficiaries. So I think that might actually be an interesting space for you to look into, is the kind of payer route to say, well, we create these very robust solutions that really focus on serving that employee through our kind of direct, either our employer market or serving maybe, Medicare or Medicaid populations in the government program space. But there are children as beneficiaries in both of those instances. So that might be an interesting area, because that would create some potential differentiation for a health plan who's looking to serve employers who are concerned about their employees' children, especially right now, as we've seen some trends in behavior, which is I imagine why you got into this space. A lot of trends for behavioral health with children within the kind of pandemic and the impact that has had. So that might, I know it's a little bit more of a challenge potentially to go B2B to C, but there are definitely some benefits, because if you get one good deal, you now have access to a whole host of people in one go, versus having to sell directly to every single individual.
Correct. And very quickly, by way of introduction, I'm from just outside Boston. So I guess that was part of the thing that I should have mentioned before. Cool. Thank you, guys.
So I'm curious, for Jake and Sarah, you have limited bandwidth in terms of what you do. So you must be constantly prioritizing projects you want to get involved in. How do you rank order, or how do you select, something that could be very profitable to the insurance company or to the hospital, versus something that maybe makes the physician's life easier but is not so profitable, versus something that has maybe a great patient outcome. But again, you're both in profit-making businesses. How do you trade off, essentially the non-monetary benefits versus the monetary benefits in how you choose projects?
I can take that first if you want. So we work with part of what we do, because our customers, our clients are all internal employees within the organization. And so they have to technically pay us, it's very internal, funny money, but they pay us to engage with them on a project or a product development or a new service design. And so part of that is almost like they need to come up with the funding to even engage us. So that itself, they need to prove some type of capital return, TBA, to get approval for that funding. Part of what we do on our side, a lot of course, as a healthcare organization, we take the quadruple aim into account. So we are looking at these different projects and saying, are we looking to provide a better patient experience? Are we looking to provide a better physician experience? Are we looking to reduce costs? And is this going to potentially improve health outcomes? And if we can say yes to all four, then that's something that we want to prioritize, because that's going to help us meet our mission and help us really push those goals forward in a positive way. If we look at something and we say this is not hitting any of those four at all, or maybe it's an incremental improvement, but it's not really going to move the needle, perhaps that's something that's best done by another group or, within the internal team. I think the biggest thing is making sure, and I think Sarah said that in the previous conversation, is having those internal champions is really, really critical. So there's a lot of swirl, there's a lot of folks in a company this large trying to do things. And we look to engage with business leaders, CEOs of business lines, because we know it's going to ideally move forward or get out the door. And that's our best chance to have an impact.
I absolutely agree with Sarah, with all that Sarah said there. And I think one thing to note too is I think there is, or at least will increasingly prove that there is a pretty strong link probably between, hospital and performance versus, provider satisfaction and patient overall experience as well. I think that's something we're always thinking about, is how can we have the best perception possible for our patients while having a great experience for the providers in our hospital as well. And then the other part of your question, Philip, around, how do we prioritize? That's a great question. And a lot of my role is about how do I think through prioritizing. We have strategic imperatives that, come from the top down, and then grassroots efforts that, coming from clinicians or providers that are looking for solutions. So a lot of times we have a lot of great ideas, I find, that we could move forward with. But what we're really looking for is exactly what Sarah mentioned, is that bite from the clinician champion who's willing to really work with us. And because it takes time and it takes resources, a lot of times we have a lot of great ideas kind of in the pipeline, so to speak. But what we're really waiting for is that initial bite, wherever that is, and then we'll kind of, push the resources and efforts in that way.
Could you guys elaborate a bit about the champion piece? Is it somebody that has actually got a vested interest in a particular area or research, or a clinician that has got something that they are trying to do a pilot trial on? What does a champion mean? What does it look like for people outside of the hospital systems or payer systems?
Yeah, I think it's probably different in the hospital system, but in the payer system, usually our champion is the one who has the budget. So who's able to potentially fund this? Who's, at the end of the day, after we've done the work that our team does, which is to help to scope the strategy, help to scope the design, do they have a team lined up that's going to be able to go run and build it? Do they have financial runway for them to really make, progress on something that's probably going to take at least 6 months to develop, let alone launch? Do they have the ability to go pilot something quickly, get that learning? And so that's almost what we almost kind of look at our potential client partners and their executive sponsors to say, are you that person? If you're not, we probably won't engage with you, because we want to see the things that we're working on and dedicating our sometimes limited time to be successful, to have that impact. And when we don't see someone really committed, they're not showing up to meetings, or they're not putting their money where their mouth is, we tend to shy away from those engagements, because it's not going to make the impact that we need it to make.
Great.
Jake, I don't know if you have a different perspective.
My answer doesn't need to be long on this one, because I totally agree with everything you said. The only thing I would add is, from my perspective, a clinical champion at a health system is going to be the person that's going to really bring the product to life and to use at the hospital. I'm an analyst who looks at the market and has a great understanding of what the digital health market is doing and key priorities, and I work with providers. But it's really the providers that are going to be implementing these things, changing their existing workflows, having the risk of using novel technologies with patients. So I look at as the clinical champion as the person who I'm working very closely with to say, yes, I'm willing to back this up, actually use this and work alongside you to make it a possibility.
Great, thank you.
A principle that we kind of live by with our team, it's if we're supporting and this is related to kind of provider experience, if we're supporting a team who's looking to make a technology that a provider is supposed to engage with, every minute of that provider's time that we're expecting them to engage in a specific product or solution, we need to be saving that time somewhere else. So should we not be adding time to their workflow if we're creating the solution? And that's the principle. So if at the end of the session, the product we've designed adds time that the provider now has to take away from a patient interaction, we failed. This is not right, and we shouldn't pursue that in the market. So for anyone who is thinking about creating physician-related solutions, I think that's a good rule to live by.
Beautiful. Thank you. Learning a lot.
Other folks' reactions to some of the conversation?
Sarah, I was sort of curious of your model. So as I understand it from what you said, you expect some executive sponsor within a business unit, I assume, that will fund it, put the team in place. So your accelerator then provides guidance and strategy. I'm just trying to understand the model of this internal accelerator.
Sure. We're definitely more of a non-traditional accelerator. So we use a lot of business strategy frameworks, human-centered design methodologies, and we work alongside a team to help them really, like, our goal is to help bring that outside in perspective. So we do a lot of user research, market research, upfront interview process, engaging with patients, engaging with providers to bring those concepts to life and to bring them into essentially a room where we're going to then do, it's a virtual room now, but it used to be a physical room. And we'll do a sprint with a cross-functional team. So we're going to bring people from different parts of the business, different parts of the product, different parts of, any other type of technology solutions that we're looking to play with. And we're going to collaborate across a series of frameworks that's going to help get us from empathy into ideation, ideation into design, design into prioritization, and then moving from prioritization into strategic planning and saying, okay, how are we going to get this done? And so we work alongside that team, and it's usually about a 6 to 8 week process. And then we will typically either build a prototype for the team as a result of what comes out of that session, or a strategy pitch if they need to go sell it or kind of sell it up the chain for funding. That's kind of how we work.
Okay, interesting. And Jake,
Yeah,
as opposed to the way you operate,
There's actually there's an internal side to our team that does a very, very similar function, that's working with internal innovators, providers, researchers, et cetera, in a very, very similar capacity. But we're also working with external startups in a really a variety of different ways. Can be the more traditional pilot or implementation kind of relationship, but typically looking also to potentially do advisory support on entering the pediatric space. Typically, companies haven't thought about pediatrics yet or looking to enter into that market. So that's something that we pursue. We also have a full stack tech development team. So we can actually, if we, particularly for products that we think really strongly about or we might have a vested stake in, we can commit actual development resources. So our partnerships are really, really tailored to the unique needs, and there's not really one standard path that we take.
Okay, thanks.
Any other final thoughts, questions, comments? I know I want to save a few minutes at the end just to make sure that Victor's all set with his key takeaways, but.
Could we?
Yeah, I was going to bring up a question real quick. This is Mateus. So a question that I had was, what are some of the characteristics that you're looking for in startups that are looking to partner with your hospitals or your organization?
Yeah, I can go quickly on this one too. I think the first thing we always really look for is team and just the general fit and the vibe that we get from introductory calls and just learning about the product and their background and what they're trying to accomplish. I think being a children's hospital, mission is, particularly important to us and the work that we do and the type of people that Boston Children's hires. So I think having that mission alignment and core values for a startup is huge. Flexibility. A lot of times I think what you come in pitching is unlikely to be what is actually implemented or piloted if it's like an intro conversation, which I think can be great, but it can also be a little bit challenging, perplexing, and a little bit taxing, I'm sure, to really think through new offerings on the spot, but it's much appreciated. And then also tailoring especially your intro presentations, tailoring the intro presentations. I've seen, I meet with a lot of startups and I see, pitch decks that are very clearly general pitch decks, which is fine. But if you can even have one slide that's 3 bullet points, it's like Boston Children's may or may not have this pain point, but I've actually taken 5 minutes to think about, okay, what problems might a children's hospital have and how could my solution address them? That goes a long way in my book because that's kind of the next step for me. So it kind of helps my brainstorming.
Jake and Sarah, if I may, my name is Victor Kutin. I am the founder of Aire Fresco, and we built a program around mindfulness meditation to build resilience and take care of mental health. What role does mental health play in the Boston Children's Hospital, and how high is it in the priority of needs?
Oh, top priority. Has been for a while, well before. I would say if there was like a top priority pre-COVID for us, it was mental health. We actually made one of our first strategic investments. Time doesn't exist anymore, to be honest. Like at some point in 2020, in a company called Brightline that provides behavioral health care for acute cases, and we have a very robust inpatient and outpatient behavioral health program at Children's. I think, like many places, capacity is an issue, and we always wish you can take on more patients, and we're looking for novel ways to meet those needs. But absolutely, to kind of answer your core of your question, it's a top priority. I think just to make sure, Victor, actually, that you're not left hanging, just want to quickly recap some of the notes that I took here to share out at the end. But first, want to thank everybody for taking the time to join. This was a great discussion. Really appreciate you all taking the time. So I think some of the things that came up on my end were just these organized health systems, payers are complex organizations. You need to think through hierarchy and how to maneuver there. Coming up with different value propositions is really, really important. Prioritizing those, like thinking through how to support patients and providers while also thinking about the bottom line of the hospital. The benefits and the challenges of B2B to C versus B2C business models. Those are some of the areas that I wrote down. Anybody else have any final thoughts? I think we're wrapping up in about 2 minutes or so.
How do we engage with United Health? I heard about Boston Children's Hospital earlier, but is there a formal way we can engage?
I'm muted. Depends on where you're looking to engage, what part of the business, but you can reach out to me on LinkedIn if you like, and we can kind of have that conversation.
Love it.
There's a few different venture arms, which is probably the right connection spot.
Great. Thanks, Sarah. Will do.
Yeah.
Great. Well, I think if there are no further questions, Mateus, did you have one? Sorry.
I was going to say, just as a final thought that you guys had mentioned was the importance of finding the champion inside of the company that can basically speak to and vouch for your company. Because if you don't find that internal champion, then it's going to be very, very difficult for it to be pushed along, because you need to find someone that has a vested interest in the company or in the product success. So just figured I would reiterate that in the next 5 seconds.
Perfect. Great. Thank you, everybody.
Thanks, everybody.